know what our eyes feel like when they're angry. But what does it feel like when they're happy? Well, nothing at all. But this is what can get us in trouble, because we can ignore when we are creating problems for our eyes, but by the time we realize that there's something going on, it's really hard to fix it because we've already created a bad habit. Today I'm going to talk about 5 different bad habits that are pretty common. Now this list is not ranked based on least bad habit to worst bad habit. They're all bad in their own way, and none of us battle every one of these habits, but at least we know someone who does. So I'll give a quick solution today, but I'll give more detail in other videos later. So let's get started. The first is spending hours in front of a screen, either at work or at home. Now I'm not just talking about computers, but also laptops, tablets, and the most common is cell phones. So staring at screens can cause dry, irritated red eyes, muscle strain, headache, and a lack of sleep. Nowadays, we spend a lot more time looking at screens than we think, and the digital screens aren't going anywhere, so we have to figure out ways to protect ourselves to avoid some of these issues. So we can get eye protection like computer glasses that block high intensity blue light, or we can set our screens to a night mode or a blue light blocker mode, which gives the screen a slight yellow or amber tint, but it relaxes our eyes. Another easy thing that we can do to protect our eyes is to look away. And something easy to remember is the 20-20-20 rule, which states every 20 minutes take 20 seconds to look at something 20 feet away or more. This is like a breather for our eyes. The second is not using sunglasses while outside. Now I live in Florida, which is called the Sunshine State, and even we forget to put on our sunglasses. Now I don't care if you wear a $3 pair of sunglasses or a $3,000 pair of sunglasses. As long as it has adequate UV protection, then you're good to go. Sunglasses protect us from many other things other than just harmful rays, like squinting, which can cause wrinkles, exposure to allergens, and flying debris. The third is overwearing or the misuse of contact lenses. Now I consider this as one of the worst habits because of how often I see emergencies related to this. Now I can't always blame the patient for it, because oftentimes it's our fault for not spending enough time with you to explain, or we didn't explain well enough. Alright, so this is a contact lens case, okay? All you're going to do is open it up. Alright, hopefully you didn't lose the contact lens, which I'm pretty sure I did. Where'd it go? Oh, no, it's still in here, got it. Alright, so you're gonna take it, and you just kind of throw that on the trash or something. And all you do is put it on your finger. Can you hold that, please? Real quick, put it in, look around, and that's it. Easy as that. All right, I have a room for you. I'll let you practice a little bit. Oh, that didn't work. I'll let you go practice a little bit, and I'll be back and see if you don't poke your eye out, all right? It's not just the do's and don'ts of contact lenses, but it's also the why. Now this is our contact lens room where we teach our patients how to put in contacts, how to take them out, how to properly clean them, and when to replace them. Now we not only want to be confident with sending you home with contacts, but we also want you to be confident when you get home, because the more you know about your eyes, the better you can take care of them without our help. Number 4 is not using eye protection. Some examples are swimming, mowing the lawn, working with wood, metal, chemicals, cooking, computers, biking, so on and so on. It's usually when we get something in our eye or get an infection before we realize that we should have worn eye protection. And the last one is not going to your general or primary doctor regularly. Your general health can affect your eyes either positively or negatively. We often make our patients very annoyed by asking a lot of questions concerning their health. Kind of like,
have you ever had or are you currently experiencing any of the following? Eye surgery, macular degeneration, glaucoma, postnasal drip, runny nose, have vascular disease, weight loss, weight gain, diarrhea, constipation, tuberculosis, rheumatoid arthritis, headache, migraine, or seizures.
What?
So you don't know what you don't know. It's your job to take care of yourself. It's your primary job to make sure that you're doing it right. And if not, then they'll help you get back to where you need to be. How we take care of ourselves can make a very happy eye or a very angry eye. So there's many other habits that we form that can take a toll on our eyes. These are some of the honorable mentions on top of what we've already talked about. Overusing eye drops, not using glasses when needed, misuse of eye makeup, smoking, staring at the sun, squinting to see better, rubbing your eyes, poor nutrition, decreased physical activity, and lack of sleep. Now don't forget, not seeing your eye doctor yearly is also a bad habit that could wreck your eyes. Now I wish you happy days with very happy eyes. Now if you thought this video was helpful, then please give it a like. If you have any questions, leave a comment below, and I'll try to answer it as quick as I can. Now here's a question for you. What's a bad habit that you battle with that could affect your eyes? Now always remember, find your true focus in life, hold on to it, never lose it, and I'll see you next time.
What? What?
You gotta look at me.